porn star. I'm a retired doctor and retired from the Navy, and this is my 10th or 11th year on the CSL, and I have my third proposal being looked at this session. I'm on the health committee for, I think, 10 years.
Oh.
My name is Edward Woods. I'm from PSA 25, Los Angeles City. I'm currently with the Department of Recreation and Parks in their senior section. Prior to that, for 6 years, I was the president of the Council on Aging for the Department of Aging, and I also spent 8 years as a social service director in a locked Alzheimer dementia unit. So that was a second career for me in gerontology, and I have a certification as a gerontologist.
My name is Erwin Fromm. I'm from Riverside County. Background-wise, include 30 years in the insurance industry. And after I retired from that, a partner and I owned a skilled nursing facility and got our licenses for that. And I'm involved with I'm vice chair of the advisory council for PSA 21, which is Riverside County. I'm an ombudsman and have been for 10 years, 12 years. I'm involved with TAC, the AAA Council of California. I'm also treasurer of the California Foundation on Aging. That's it. Thank you.
Thank you. Again, I'm Dee Ehrman, the chair, and
I'm Bob Jaffe. I sit on the advisory board of Santa Clara County, which is the PSA 10, that's the Council on Aging. And other than the advocacy I've been doing for seniors, Methuselah and I became senior legislatures the same year. Thank you.
Thank you. And I'll introduce our help for today. We have Ledge Counsel, we have Stephanie. And Stephanie, do you want to be referred to as Deputy Counsel, Ledge Counsel? What would you like?
Whatever you please.
Okay. All right. And then our resource person is Brenda. Do you each want to say something about yourselves for us?
My name is Stephanie Hone. I'm an attorney with Ledge Counsel.
Okay.
And I'm Brenda Austin. I'm volunteer coordinator for the group and just here to help out wherever.
Thank you very much. And then our committee helpers in the back, the messengers, we have Will. Will's going to do the phone. And Barbara is going to be a runner. And George is going to be a runner for a while, right? Okay, thank you very much. I appreciate that. We've decided, because we only have 5 proposals, that we'll give each testifier 5 minutes. Okay. Or do we say 10? 10. Oh, excuse me, 10, because we have enough time for them to speak. And today we will go through the bills, and then tomorrow we will go over the ones from the Assembly. And the way for Ann and anyone who doesn't remember, I read the name, the number of the proposal, the author, and the title, and ask for presentation of the proposal. And we have to make a motion to listen to the bill. So you could say, I so move that we hear this bill. And then after the person testifies, and we're saying, are we going to say 5 minutes beginning and then 5 minutes rebuttal time, question time, or make it extra?
No, just.
Well, anyway, they'll have it up.
Give them a 2-minute warning.
Right, and
he's got a second-hand watch.
Good.
Okay,
good.
So do you want me to operate the timer at all?
Oh, you have a timer?
I do have a timer. If you would like me to.
Yes, Brenda, that would be nice.
Give them a 2-minute warning.
After the author has given you the testimony, you may ask him questions, and if he has some backup with him, like a witness, we can ask that person questions also. You can ask committee members, they can ask anything they would like of that person. I have to just make sure you won't be speaking out of order. Like, I don't think we're going to get raucous here, but who knows? And anybody on the committee may move the proposal, which means that we have heard it. If no member moves the proposal, then the chair asks for a motion to move. And I know we've all been on this committee for quite a while, and I think we all know that. This was a question I had about amendments. I asked Stephanie earlier. An author may propose an amendment to his or her own proposal, and no motion is needed. Now, this was the question I asked her. Committee members may make an amendment with or without the consent of the author. And that was a question that came up this morning. This requires a motion and a vote to adopt the amendment. And then Ledge Council will draft the wording for the amendment. So that's when her job really comes in, to turn what we say into Ledge language. And in big letters, a proposal cannot be amended only to add the name of a co-author. That's kind of funny. All votes are roll call conducted by Brenda, our resource person. All members of the committee and the chair vote. At the end, she will announce the results of the vote, and she will say, for instance, Mr. Smith, your proposal as introduced or as amendment has passed the committee, and she'll give you the vote. And votes are always recorded in this order: aye, no, and abstain. Okay, that's the way that she's going to do this. The vote terminology is do pass as amended, pass as amendment. Do pass, which means pass with dissenting votes. On consent means pass with no amendments and no dissenting votes. And the proposals that are not amended and receive a unanimous vote will be placed on the consent calendar for the following day's floor session. The consent calendar is voted on as a package, but each proposal will be explained on the floor. Do not ask for a dissenting vote in committee or take your proposal off consent just so it can be heard on the floor, which is an interesting thought. All proposals will be heard on the floor. After all the proposals have been taken up and voted on, then they move forward, and the staff takes the second day of hearings, and that may not be the same because of what happens in our votes. And I would remind you before the meeting is over to make sure you take all your personal belongings with you when we leave. If the volunteers find anything, it goes into the CSL staff room, which is 105?
125.
125, okay. You know where that is? 125 is the other end of the hallway down there. And I know in the past we have lost a couple of times somebody's purse, so that's where it goes if it gets found. So we need to be aware of that in case that happens. Okay, does anyone else have anything we need to say? So we need to send for the first person.
I just did.
You did.
Do we need, I mean, I've kept track of, we know who's here, but would you like to do an official roll call where I call out names?
Yes,
Okay.
please.
All right, so I have Dee Ehrman.
Here.
Erwin Fromm.
Here.
Bob Jaffe. Here. Sandy Miller. Here. Lynn Pankhurst. She's absent.
Yeah.
Bruce Steer. Here. Edward Woods. Here. Ann Casper.
Here.
Thank you.
I think I would suggest almost that we call two at a time so that somebody does show up.
Yeah. Okay. Then let's do.
So what was the message, George?
Kim, is it
Selby.
Joanna Kim Selby?
Yeah, she was testifying.
Okay.
And then Lundin was in a discussion.
So we'll,
We have two of them. Yeah, so I'll send out for the next two.
yeah.
So we have man and they. Man. You have an author of a last name of a man? Are you familiar?
Horace Mann?
And he's here. Where is he at? I don't have a room, I'm sorry.
How about Senator Lundin? He's here
Lundin was not available
right at the moment. Okay.
at the moment, so let me find
I wonder who's doing,
where Mann is. I'm sorry, his room number was not listed, so let me
Okay.
find him. You see him?
did you know that, this a little aside, that Horace Mann is related to Horace Mann? That's who he was named after. It's like his great
The insurance company?
grandfather,
You know, there is an
Yeah, I
insurance
know.
company called that too.
something like that. That's what I
He's
thought.
not on the list. He's not on any of my list.
He did resign.
I do not know what committee he
So
is
what are we going to do
on.
with his?
We're going to go for Connie Eaton. I know she's here somewhere.
She's here.
Yeah, and so is
Okay.
Leslie.
She is in
Yeah, so
47.
skip those.
All right, so we're going to
Now,
do...
in the case, Ledge Council, in the case of Senator Mann having resigned from the CSL, but yet we have his bill or proposal, should we have someone else present it, or what do we do in that situation where? Well, that's, but, you know, I don't know, since he resigned, it's still in our book.
If he resigned, let me send a message up to our office to make sure that if you would like to present the bill, that you could step in as an author.
Okay, that would be good. So if I can present it, then we can go ahead with that. And since we have that situation, I don't know, Senator Thompson, do you know Senator?
No, I do not know.
Do not know.
I didn't know Mann resigned.
I did. Brenda, you know what I would think? When we have so few bills and we got these problems, it would be almost, you just try to get anybody.
We are. We've got...
So we're not just sitting here, but
Right.
I don't know legally what we do about Senator Mann having resigned.
He resigned. Is that what we found out?
Yes.
He resigned?
Yes.
And I don't have any notes that he is sending anybody in their place.
That's what we're finding out.
And that's where Stephanie's going to go find out. Yeah, because that...
She's going to check to see whether,
Okay.
as chair, that I can read it and present it. And it is a rather simple
Yeah.
proposal. So I would suggest that the members of the committee look it over while we're waiting for someone, so you know if I can present Senator Mann's proposal, which is shingles virus prevention inoculations that would be covered under Medicare. So that's what we'll be discussing if I can present it. So for right now, we'll just relax until we get someone to speak.
Quick.
I don't have an official word on whether you'd be able to take Mann's proposal. We're a little bit concerned that he might have had to appoint a new author if he was going to have someone else hear his proposal. So I have someone double checking the rules and will get back to me.
Okay,
That's the status on SFP 2.
okay, thank you. Oh, good, we got the general here.
Okay. Sorry I had to give my own presentation in my own committee. And since I've got 4 to go, oh gosh.
General, greetings, and I want you to know that we are being televised, so I know you will have the proper decorum for the hearing.
Your mic is on.
Mic is on. We have to have a motion to... Okay. Yes, we're fine.
I make a motion to hear the next.
Proposal, which is Senior Senate Proposal Number 8, Senator Lundin, is that the one that you're ready to testify on?
I'll second.
Yeah, let me see what he says.
Senior housing security.
Thank you. Okay, so you move let me hear the proposal. Is there a second?
Second.
All those in favor of hearing the proposal, say aye.
Aye.
Thank you. We will hear your proposal, and we are giving you 10 minutes.
Thank you, Madam Chair. Thank you, committee. It's a pleasure to be here and present this to you. It's a simple thing. When people go into a rest home, long-term facility, sometimes they're waved in if they're carrying a flower pot with a flower in. Oh, isn't that sweet? Isn't that nice? We don't know who they are. We should know who they are. All this calls for is a log in, log out register, very simply, with a driver's license and a statement of relationship or business with the client. That has to be known. Because there are too many assaults, robberies, and even rapes in long-term facilities. Canner will bear that out, the Canner report. If you read that, it's about that thick.
Tell who Canada is.
Pardon me?
Tell who Canada is.
Well,
I know what it is.
no, go ahead.
It's California. Help me. California. Home reform. Yeah.
Thank you. And it's hard to remember a lot of these things. But at any rate, when you read that and you see this happening, how? What's going on? So if you can narrow this down by a simple identification, sign-in, sign-out process, where we can verify the person so they know that we can track them and their purpose for the visit or relationship to the client, a lot of people might just turn around and say, oh, I forgot something. I have to go back downtown. It's a very simple procedure. It doesn't cost anything. And it may be able to narrow it down to where we can find out if it's an inside job. Everybody follows me on that? There's a process of elimination. Very simple, no cost to anybody, just something that has to be done. Don't let them in because they smile and wave or carry in a nice potted plant. That's it in a nutshell.
Dr. Steer?
Yeah, General London.
Yes.
What you just addressed now was primarily identification for security. But what about surveillance? Will there be increase in surveillance cameras in rooms or corridors?
I've asked for a simple walk around. Walk around. Person doing checks. I guess when you get into surveillance cameras or recording devices and things, you get into some technical things with the law, which may cause problems. And right. I have asked for a more simple way.
Yeah, because the majority of abuses, I've been told, and I'm pretty sure it's correct, the majority of abuses are from family members.
That is correct.
Identification is not going to help that area.
Well, it's just the fact, too, that during this budget crisis and everything, I was trying the simplest way and the quickest way to possibly ensure better, should we say, hands-on surveillance rather than electronic.
Thank you.
Thank you, Doctor.
Okay.
Erwin Fromm, and we know each other from
Yes.
the past. First of all, I'm a long-term care ombudsman and have been for 12 years. I owned a skilled facility in North Carolina in the past years. I take a little issue with some of this. First of all, virtually all the facilities I'm not talking about the little mom and pop. I'm talking about the larger facilities. Do have a process that people sign in. They know who is in the building. At least all the ones that I go to have such a sign-in. They don't require, and I kind of take issue with this, of verification of identity. Now, I can understand your caution on it, but I think you're getting a little carried away with the normal public reaction of people coming into a facility as a visitor, signing in and going on about their business. I have not, and Dr. Steer was absolutely correct, most abuse occurs from family members. You do not see a great deal from a visitor coming in for them on either stealing or whatever. At least my experiences have not. I'm not saying it doesn't happen, but my experience have not. And you get involved here with identity, verification of identity, and if provided by next of kin, be an authorized visitor. You've got a residence rights issue that gets involved here also. Next of kin may not have the authority under a power of attorney to dictate who should be a visitor, who should not. The resident has that choice primarily, unless they're not qualified anymore. I think the idea of caution is great, but I think maybe some of the provisions here are a little strenuous.
If you tighten it up, Senator, lots of things could be prevented. Even the family member could be on alert to behave themselves. So aren't you requiring a family member to sign in?
Typically, yes. I'm sorry. Typically, yes.
Okay, well.
But you see, signing in that they're there doesn't necessarily mean you've controlled any abuse potential. You already know they're there.
All right. It might be after the fact, but at least they know who the last person was in the room for the event. I'm sorry, but it's a matter of just narrowing the gap, simply at no cost.
I would like to interject. On page 231, it says that hereby proposes that requirements for security and surveillance of all long-term care facilities in the state of California be increased. So that's a rather loose term that wouldn't be interpreted like you're interpreting it. If that is his resolve, and he's talking about a guard, and if you look lines 46 through 55, what his resolve is doesn't get that finite. I mean, it's in here. Whether we would suggest that that part be deleted, if you find that is a question you can't ask. I mean, let's look at the airline industry right now, what they have to do for security, and we're all used to showing driver's licenses. I visited a friend in a long-term care facility last week, and I did have to, they asked me for my ID. I signed in, and I gave them my ID. And someone took us to, and I did notice there was that just happens to be one, a security guard. So I think maybe we need to look at his resolve and decide if that's, that's the meat of it, the resolve.
I have a further question. Yes. That you have an employee or other designee initial, perhaps, as a receiver of the person coming in. I'm thinking of not skilled nursing, but assisted living places where sometimes there isn't someone at the entrance, and an acknowledgement that someone has been receiving this person just to initial after, the signature or whatever it is that they're filling out has been made. Is that something, sir, that you would...
That it should be witnessed.
Yes, that's exactly what I mean. Just an acknowledgement,
in a nutshell, acknowledgement
that the person didn't just slip in, because if they're just slipping in, they could not even abide by this request.
Yes.
I agree with you, General Lundin. Whatever you could do to get it going where the safety of the patient is really the uppermost thing. It could be a family member, but if that family member signed in and you knew exactly who the family member was, and after that family member leaves, you see a bruise on the cheek of that particular person, which wasn't there before, you can approach that family member and, et cetera, accuse him of, or speak to him about what happened when you were visiting mom. Did you get upset in any way, and, et cetera, et cetera. So even as a family member, at least you know what family member was the last person that saw her after someone witnessed or saw something happen to the resident after that person left. That looks strange. So I agree with what you're trying to do.
I'm open to amendment if you want to place a sentence that witnessed by proper authority or by...
Dr. Steer
or acknowledged.
Senator Frome, is there any, what you would like to do, make an amendment for his proposal?
No.
No, okay. Dr. Steer, do you have any? Okay, I think, Brenda, we're ready to call for the vote. For the vote?
Okay, I have D. Ehrman.
Yes. Aye.
I'm sorry, I just have last names. Erwin Fromm.
Yes.
Bob Jaffe is gone. Ann Casper.
Yes.
Sandy Miller.
Yes.
Absent. Lynn Pankhurst is absent. Then we have Bruce Steer.
Yes.
And Edward Woods.
Yes.
All right, so we have a vote of 1, 2, 3, 4, 5, 6 ayes. Okay, and I'm sorry, Madam Chair, how do I need to let you know we had 6 ayes. We had 0 noes, and we had 2 that were absent. So I'm not sure how we...
We have a quorum. We have a quorum.
We have a quorum.
Yeah.
Yeah.
Stephanie, maybe after this, then you will say whether it's on consent or whatever.
Sure.
She understands it.
The item passed on a 6-0 vote. Would you like to leave the roll open for those who are absent right now to add on, or would you like to just
I think we let the
have
vote
them
stand.
abstain?
They'll abstain, yes.
Okay. So there's 1 abstention. It still do pass, and it'll be on the consent calendar.
Thank you.
Who's the abstention?
The abstention is Senator Jaffe, who's currently absent.
If he's currently absent, how can he abstain? It would be
A 6-0.
It is on the consent calendar.
But then I didn't think you could have an abstention on a consent calendar.
No, you can't.
Yeah. As long as there are no votes, abstentions don't matter for the consent calendar.
Okay. General, thank you very much.
Yes, it is.
And I thank you, Madam Chair and committee, and thank you very much and for understanding. And I think, as Senator Woods said, let's take a step in the right thing. And thank you, and have a great day.
And for you, General, I'm so happy to see you back again.
Yes.
And looking wonderful and smiling again.
And so do you too.
We were praying for you.
Thank you.
You're wonderful. Thank you very much.
Thank you very much.
After General Lundin leaves, I would like for that testimony table for the person that's testifying to just be in the middle, because we could not see him behind you.
With my big head.
Chair in the middle.
Yeah, so I think we're just going to have one chair in the middle so that we can, because you guys will still be okay. We're here, we couldn't see his face. So I'm just trying to make it so. And look, Connie is a foot shorter than he is, so
But you know, you got. Yeah.
Yeah, right, exactly. No. I'll go to Eaton. We now have a proposal by Senior Senator Eaton. Senior Senator Eaton is here in the chamber, so I would like to move to hear her proposal. Move. Thank you. Senator Eaton, if you, especially you are, I need a second. We have a first and a second. We're sitting you in the middle because we can't see you otherwise.
Oh, sit here?
And we couldn't see the general, so you know he's a foot taller than you are. So.
Absolutely.
Yeah, stay to your right a little bit because they can all see you if we can't. So
Oh, okay.
we want to see your face.
Uh-oh.
And Senator Jaffe has returned.
I can see all of you. You can see me. Is that right?
Yeah. You could sit on your legs or something.
I can see it out.
All right.
Just a little height challenged, you know.
We will hear Senior Federal Proposal Number 6, introduced by Senior Senator Connie Eaton. The title is Social Security and Medicare Program Financing. Thank you, Senator.
Thank you for the opportunity to present this federal proposal. Having been an employee for the Social Security Administration for these many years, retired now, when I first was involved in reading the trustees' report regularly, I really didn't read them. I just kind of glanced and shoved it on a shelf, like many of us do with our periodicals and things affecting our work. But over the last few years, I've become more involved in really looking at the trustees' reports. And if you're listening to the news at all, you're getting little smatterings of it. Trustees, the last one just came out recently that indicated that the Social Security Trust Fund will no longer be self-supporting in about 5 years. In about 5 years, all of the IOUs that the government has given to Social Security will have to start being retrieved, which those IOUs that they've been taking from the Social Security Trust Fund monies will run out in about 2040, which means at that point in time, the amount of taxes coming in to pay benefits will only give about 70 cents on the dollar. So we're looking at some real critical needs here. We've heard talk about privatizing Social Security, privatizing parts of it, doing this, raising the retirement age, putting a means test in. All kinds of things have been offered to shore up Social Security and with it Medicare. And I'm not getting into the new Medicare legislation and problems with that because I don't want to go there. You don't want to hear what I think. So we don't want to go there at this point. So it's really critical that Congress address the job of shoring up the Social Security and Medicare financing of the programs. An attempt was made in 1984 when Reagan was president, and they came up with some solutions. There were some proposals, and it held off these crises for a few years. But they have now back, and with the economy in the situation it is, where people are not paying Social Security tax because they're not making any money. That means that we're going to be in that critical mass much, much quicker. And next year we may be hearing that Social Security will be in trouble in 2014 rather than 2017 if the economy keeps on like it is. So it's really critical that we look at doing something to address Social Security and the problems with its financing. I'm not proposing that we raise the retirement age. I'm not proposing that we increase the tax base. I'm not proposing that we means test it. I am proposing that Congress address the issue. A few years ago in the 90s, when Senator Monahan from New York was still involved in a review of it, his group proposed taking 2% of the Social Security tax, the FICA tax, and putting that, allowing people to privatize that portion of it. That 2%, I wondered why. That 2% was the amount that was not needed to pay current benefits. And so that was money that the government was going to take and use somewhere else. And I want to caution you about the IOUs because even though the government holds this money to pay Social Security back, it has to come from somewhere. It has to come from general revenue somewhere, which means raising taxes, cutting something else. And so it is just critical that we do something about Social Security. And I felt so strongly about it that that's why I decided I'd do this proposal, because it just is a problem that too often we do not want to see. We want to push it under the rug and ignore it, thinking it'll go away. And it really won't. And it's time that we as a seniors and as a state put some pressure on our legislators in Washington to deal with the issue. Deal with it. There are things against raising the retirement age. Might work if you do a sit-down job and only work in an office. Won't work if you're a construction worker. Your body wears out. So we've already raised the retirement age to 67 officially for full retirement age for people born in 1948 and later. And that'll be coming down. But people's bodies, when they do physical work, they wear out. And so what it would end up happening with a good many of those people, they wouldn't be eligible for the Social Security retirement if the retirement age is 70 or 75. Then they would file for disability, which is a similar program handled under Social Security, but it's still taking the money out earlier than what we would have proposed. So I'm urging you to accept this proposal, that we urge our Congress to do something with the financing of Social Security and stop messing around and putting it off, thinking it's going to go away, or that some other legislature is going to have to deal with the problem when it's become more critical.
Senator Eaton, I don't think we pointed out this is a federal proposal, so that we didn't announce that was a federal proposal. And my other question to you would be,
It is a federal proposal.
I know, but it wasn't announced as such.
I'm sorry. Gotcha.
I didn't announce it correctly, so that's why I want to make sure everybody realizes it is a federal proposal that she's asking. So in essence, you're just proposing that a committee or something be set up to look at this problem?
No, that a resolution go out of our state legislature to the federal Congress to do something, to get off the dime and make some changes to shore up the financing of the program.
They may have any questions.
Was that firm enough?
Go ahead. You're better at it than I.
Not necessarily. It occurs to me with the changes that have occurred with Medicare payments from the beneficiaries, paying more for Part B.
The monthly premium increase.
Right, and I'm assuming that has made some different. I'm just questioning whether it is appropriate to include Medicare in this, or whether to limit it strictly to Social Security.
It might be a little background on Medicare financing, because the taxes paid for Medicare program are part of the Social Security tax system. The monthly premium that a person pays for Part B Medicare originally was $3 a month. Okay, that was originally $3 a month, and now it was 96 something or other right now?
Well, if you're new to Medicare, it's 110
if you're not covered by Social Security, it's 110. Right now, if you're covered by Social Security, it's 90 something dollars, because they had a
few years.
They had a grandfathering that it wouldn't increase if your benefit didn't increase. So your premiums wouldn't go up if your Social Security benefit
if you were a current beneficiary.
Yeah. Right. No, if you were a current Social Security beneficiary and your Social Security check didn't go up, your Medicare premium wouldn't go up. If you're not on Medicare, if you're not on Social Security, your Medicare premium went up. Right? Mine did.
Yes, but there was also, I can't remember exactly. Anyway, I am still paying the original 96 whatever it is, because I was on Social Security at the same time that I started drawing.
Exactly.
Yeah. But it really has increased. And actually that's, but my question remains, is it appropriate with the changes that are taking place in Medicare to include Medicare in with
Yes, it
the
is.
social? Okay.
It is appropriate because it's the same funding base to look at at supporting it, because whether or not we have the new Medicare or the new health care legislation, whether it continues or not, it's based on funding from Medicare. So it is critical that you tie the two together, because it is based on the new health care bill proposal, law, excuse me, it's not a proposal or a bill, it's law. That new health care law is predicated to a degree on money coming from Medicare, by the support, by your monthly premiums, by the taxes that people pay when they work. So that the financing of that health care program is predicated somewhat on Medicare itself. Does that answer it? Your question? Did I confuse the issue even more? I could. Give me a chance.
Anything related to Medicare is complicated.
It is complicated. You're right. Well, you ought to know.
Madam Chair, did you need a couple-minute warning for the 10 minutes? Because was it 10 minutes for her to talk? And it is a couple minutes until the end.
On page 245, if I'm not, line 59, if I'm not mistaken, resolved that the senior legislature of the state of California respectfully memorializes the Congress and the President to enact appropriate legislation that would address the concerns. Oh.
Mic needs to be on, please.
All the mics.
My question would be that when you say respectfully memorialize to the Congress President to enact appropriate legislation, I don't see where it says that we want the state of California legislators to send a resolution. And does that have to be specifically stated? I'm asking Ledge Council.
As written right now, the only thing that would be sent to Congress and the President would be the resolution from the senior legislature. There's currently nothing written as is that would encourage the state of California's legislature to memorialize Congress and the President similarly.
I think Senator Eaton, what she's looking at is line 53 and 54, where you say that the senior legislature of the state of California at its 2010 regular session hereby proposes that solvency of the Social Security and Medicare Program Trust Fund be addressed.
I see where that is. I see where that is. It was in my original proposal, because resolutions have to go from here to the state, and that had been. And I'm sorry. It was in the original one, and so it would have to be amended to include that in order to make it work.
So do you wish to?
I would love to, as the author, amend this resolution or this proposal to show that the CSL, California Senior Legislature, would send it to the regular California Legislature to adopt and send to the federal Congress.
All right, so we will wait for Ledge Council
and whatever the
to see
proper
what
language
she can
would be.
come up with for you.
Madam Chair.
Yes.
I believe in this particular situation, any federal proposal that is done goes through the same procedure of going through the California state, and then it goes on to the federal government. That is the procedure that we follow for any federal proposal. That's the mechanism how it gets to Washington, D.C.
Well, I think Senator, the conflict we're seeing here is that it says on line 54 that the senior legislature do that.
Yeah.
It does not say that the California elected legislators would do it. It unfortunately says that the senior legislature would do it.
Yeah.
So I think we need to make it the state legislators, not the senior legislature. I mean, that's where it hung up, is line 54.
Yeah,
So
I see that.
When she finishes that, then we can see.
Question. Would you want the state to encourage the federal government the same text as currently is between 53 and 58, that they propose the solvency of the Social Security and Medicare program trust funds be addressed? Or would you like more of the resolve clause in 59 to 62, where you would be encouraging them to enact appropriate legislation?
What if on line 59, you just took out the word senior in front of legislature? So it would say resolve that the legislature of the state of California.
Because you're not the legislature of the state of California, so you cannot enact things on their behalf. The lines 59 through 62 are contained in all of the senior federal proposals, because that is your action. What I had in mind was drafting a new resolve clause that we could put in between lines 58 and 59 that would say something like, resolved that the senior legislature of the state of California hereby encourages the legislature of the state of California to, and then whatever you would like to put after that, whether that's to enact appropriate legislation that would address the concerns set forth in this measure, something as broad as that, or something more specific.
Senator Eaton?
I think something as broad as that, because I don't think we want to limit, because we need to leave it as wide open as possible. That, yeah, I just don't think we want to limit it. So I think that sounds good.
Yes.
Madam Lit Counsel, then you'd probably have to take out the lines probably 53 through, I don't know, 58 or whatever it is.
I don't see those being in conflict. You, as senior legislators, could still, in this session, propose that the solvency of the Social Security and Medicare program trust funds be addressed.
Just needs another resolved statement clause in there.
Yeah, I think so.
Good point. Thank you.
That's an interesting thing, Senator Eaton, since we heard about that today, about a gentleman whose proposal got kicked out because it had no word senior in it and had been written up by the Ledge Council and left out. Anything that was related to seniors, so it got kicked out because it didn't say the word senior.
Yeah.
So we're kind of doing reverse.
I understand. I appreciate you catching that.
Ledge Council will read it to us when she gets it together.
Yes, Madam Chair.
And then our vote will be to accept it as amended.
Well, first you'll need a vote on the amendments and then a vote on the measure as the whole.
So in order to vote on the amendment, when she gets it ready, Ledge Council will read it to us, and then we'll take a vote on the amendment.
I'm sorry, are they ready for voting?
She said we have to vote on the amendment.
The author?
Oh, no, my mistake. If it was made by the committee, you would need to vote on it. If it's made by the author, we can just vote on the proposal as a whole.
We're assuming that.
Yes, absolutely. Without question.
It's made by the author.
I need some clarification. Senator Woods said that all federal proposals have to go through the state first. Is that what you were?
Yes.
I'm not aware of that at all, and I'd like to know if that's the case. Does a federal proposal have to go through this, be approved by the Assembly or the Senate here first?
No.
There's no approval needed, but that's the mechanism how it gets to Washington, D.C. We don't send it from the senior legislature to Washington, D.C. It has to go through a state entity for them to send it on to Washington, D.C.
I mean, I can't go with a proposal to U.S. Congresswoman or man and let them take it to Washington?
Oh, you can.
well,
No,
you
you
can.
can, but it wouldn't be from the CSL.
Right.
Oh, yeah. Well, I'm CSL, and I can't take a proposal that's going to be voted on here and go to a congressperson?
Well, you could to an individual, but you couldn't to the Congress as a whole.
And you,
I mean,
and you couldn't say you were representing the California State Legislature because that's not the procedure in which it goes through in order to get to Washington. You could call your senator or congressman and say, I have a good idea for you. Yes.
Put it on alert. Are we ready?
If you're ready for the language, Chair.
We will hear the amendment.
The amendment would be to add in between lines 58 and 59 the following resolve clause. Resolved that the senior legislature of the state of California hereby encourages the legislature of the state of California to pass a joint resolution encouraging the Congress and President to enact appropriate legislation that would address the concerns set forth in this measure, and be it further.
Okay, we'll take a vote on that amendment. That's the amendment. The amendment
is made by the author, so you don't have to.
Right.
You don't have to vote on it.
we have to vote on it.
No, I meant we don't have to vote on the amendment. We just vote on how it's presented.
The whole bill, the whole proposal.
Ledge Council will tell us again what we need to do.
If the author accepts the amendment, then the author at the chair's, when the chair is ready, the chair can ask for a vote on the entire measure. There does not need to be a vote on this amendment. And I would just remind you so we don't get another phone call to turn your mics on when you talk.
Okay, let's call the question.
Thank you very much. Did you hear what she said to you? All right. Is somebody going to move it, or am I going to move it? I move the question. Thank you. Second?
Second.
And she'll call the roll.
Ready? All right. Urban?
Here, yes.
Fromm?
Yes.
Casper? Miller? Pankhurst is absent. Steer? Woods? All right, so we have 6 ayes, 0 noes, and again, the one abstain.
So the measure passes, the 6 ayes, 1 abstention, and because the measure was amended, it will not be on the consent calendar.
Okay. Thank you.
I mean, thank you. If you thought I was passionate about Social Security, it has been my life for a long time, and I still feel good about it. Except when you go into an office, I'm not too sure.
Thank you.
Thank you.
Thank you, Senator Eaton. We appreciate it. So at this present moment, we don't have anyone. What was the story on Senator Kim Selby?
That one, is that a she? I'm sorry. Testifying. She will get here as soon as she's done.
Okay.
I sent Barbara over for Thompson,
Okay.
who's just in next door, so hopefully that person is back.
Okay.
Should be
And
here
then do we
momentarily.
have a determination yet on Senator Mann's proposal? Senator Mann being the person who resigned?
Yes, since Senator Mann will remain the author. However, after reviewing the rules, we've determined that as chair, you're required to present his proposal. And so whenever you would like to do that, if you'd step down from the dais and present it.
Oh, okay. Since I have a great deal of difficulty walking or standing, could my vice chair do it?
I think that would be presentable. The other option, as the chair, you can run this meeting as you see fit, and if you would like to present it from perhaps another location, I wouldn't see a problem with that.
You want to do it?
What, sure, I'll do anything. Go to another location.
You can go down there and present the bill,
Okay.
if you would. Thank you.
And I'm sorry, can I? That one is.
read this before, but obviously I'm going to be going through it again right now.
Go ahead, and we'll all refresh ourselves.
This is from Senator Mann, and has to do with Medicare coverage for the vaccination for shingles virus prevention, and it is available only to individuals with applicable Part D coverage. Persons are not eligible for Medicare until 65 years of age. This measure would memorialize that all persons 60 years of age and older eligible to receive shingles virus prevention inoculation free of charge through Medicare Part B insurance coverage. And I can tell you I went through the process already, and I did have to pay at this stage. So I totally support the resolution. All persons, I'm repeating now, but it's further on, all persons 60 years of age and older shall be eligible to receive shingles virus prevention inoculation free of charge through Medicare Part B insurance coverage. Yes.
I think there's a misnomer here. If you're going to receive it through Medicare Part B, you have to be 65 and older. And here it says all persons 60 and over. That should be changed to 65, just the way you get the regular.
I think that's a valid point,
yeah.
Yes.
Yeah.
You agree on Ann on that? What do we do, Ledge Council? Just alter the, amend it to show, I'm sorry, you're the chair.
My question would be, if you read on the first page 239, what he's saying is he wants it for the people that are not eligible right now.
Need to send that to them.
What he says, Medicare coverage for the vaccination for shingles virus prevention is available only to individuals with applicable Part D coverage. Persons are not eligible for Medicare until 65 years of age. This measure would moralize Congress. That would make all persons 60 years of age and older eligible to receive shingles. So he's made that differentiation. He's acknowledging that you can't get it now until you're 65. So he's asking to make it you eligible at 60. That's the whole point of this.
Yep. I'm not sure.
He's trying to lop off, make you eligible 5 years sooner.
Yeah, but if Medicare is going to pay for it, they're not going to pay for it if you're only 60.
Well, but that's the point of his whole proposal.
Yeah, but it doesn't, you're going against.
Unclear. It just makes it very unclear.
Yes, but then
No, but you're
that was
going
the point.
against what Medicare is set up to do and the age requirement for Medicare.
So at this point,
Where is that money going to come from for people 60 to 64 point whatever to get this free of charge?
But then
there's no mechanism.
I would suggest you vote no then, because the whole point of his writing this was to get rid of the 5 years. And he says that it has proven to be effective in over 50% of those inoculated. So that's what he says. Zoster is a very painful, debilitating disease that can lead to death. The virus is most prevalent in adults over 60 years of age. So he's trying to cut it so we can get it at 60, not wait.
There's another kind of a bump in the road. I believe, and Doctor, perhaps you have my thing is on, perhaps you have the knowledge, because I can't remember, I'm getting older and my memory is failing me, between Part B and Part D, that can make the difference as to whether it is covered or not covered?
You have to have D.
Yes, I realize that,
Yeah.
but there's something about the inoculation.
I'm not sure
it's
where
very
that would
confusing.
lie, but I do know this, that if you're not on Medicare, it's about $200
Yes.
for the inoculation.
265 to be precise.
That's what he's trying to prevent. He
Right.
wants to lower
But
the age.
If you're not,
Currently-
I'm a Kaiser patient, okay?
Yeah.
And I got my shingles inoculation. My co-payment was $45. If I was not 65 and not on Medicare, it'd be $200.
Okay, I'm a Medicare Advantage Medicare patient.
Okay.
And I got the injection, but I had to go and find the stuff and because my plan, because it was something about the B and D distinction. That's what I'm saying. It's very unclear here, not only with the 60 to 65 wanting it to be covered by Medicare, but also this lack of clarity that exists currently in the Medicare Part D drug
I think
program.
it would come under Part B, but I'm not positive of that.
Whatever the flu shot.
I had the shot also, and I'm with Dr. Steer there. I had to pay.
I had to pay too.
You know, and,
yeah, I had, but I also
I
had to
have
go
Part
get
B
it
and I have Part D
and
through,
pay for it.
You know,
One
my own
person at a
coverage.
time, please, members. I think the whole point of his proposal, no matter how we try to figure it out the way it goes, his whole point was he wants you to get it at 60, not 65. If you change that, you've wiped out, there's no reason for it.
There's no
Because you can get it after 65. So the point of his is 60, and if it's not something that's workable, particularly right now, I think then we would vote it down.
I agree with you. I think it
Because
needs
there's
further
no way
work.
to amend this. The only way you would do is just start over. I mean, it would be superfluous for him to say 65.
Point of information. Senator Fromm, you received a shingle shot,
Yes.
and you have Medicare Part D and Part B,
Yes.
A and B, and that did not cover, the shingle shot is not covered
No.
the way the virus shot is covered. Am I correct?
What is covered?
The shingle shot that you received and had to pay for is not covered in the manner in which the regular
Yes,
virus.
Yes.
Yeah, okay.
Regular virus.
What do you mean, regular?
Yeah, I mean, the shot that we all should
flu
get.
shot?
The flu shot, yes.
Oh, the flu shot. Oh.
Yeah, yeah.
Yeah, no, I definitely had to
You
pay.
had to
And
pay.
Dr. Steer said he had to
So,
pay.
yeah, so-
And had to
Okay.
pay. And I
So
think
actually, the way he should have written the bill was that this should be covered under that same thing that the flu
but
shot
leave
is
the age
covered.
frame alone, and that's
Right.
Pete's point, and I think she's accurate.
Let's call the question.
Yes.
Yes.
Okay, you can call the vote. Resource person, thank you. Madam Resource Person,
Ehrman?
yes. No, I'm no,
No.
excuse me. I'm no.
Okay. Fromm?
No.
Jaffe? Casper?
No.
Miller?
No.
Pankhurst is absent. Steer?
No.
Woods?
No. So it failed.
The measure fails. 6 no votes, 1 abstention.
Thank you very much. And Madam Resource Person, who is the person we have now?
We have Thompson
Oh, wonderful.
for SFP 7, I believe. Your SFP proposal number 7?
Yes.
Okay.
If you would be seated there, thank you for appearing before us, Senator Thompson. And do I hear a motion to hear her proposal?
So
If-
moved.
Those in favor? Aye. This one is, again, a federal proposal. Medicare discharge rights notice. All right, Senator, you may present your proposal.
Thank you for having me. The proposal would benefit very, very few people, but it's a proposal to make sure that people who are in the hospital know that they have not only the right to appeal their discharge date, but that Medicare will pay for them to stay in the hospital while that appeal is being heard. That generally is, it can be as much as a full day, but never longer than 1 day for them to reconsider whether a person should be discharged. Now, nearly everybody wants to get out of the hospital absolutely as quickly as possible. But there are situations where someone truly does not feel that they are capable of going home and being safe in their home with their condition. And I have determined that most people do not know that they have this discharge right. Now, when you go into a hospital, the first thing that happens is you see the admittance person, and they give you 27 forms and say, sign here, initial here, initial there. They give you copies of these forms. Generally, you hand it to your husband or to your friend, whoever came with you, and those papers disappear forever. Nobody reads them. Nobody knows what they are. The Medicare administrative rules telling the hospitals how they have to notify people and what must be included in this written notice is something like 27 pages long. And hospitals generally do comply with the letter of the law. They give these people a form, but again, there is nothing to tell these people orally what is in the form and remind them on the date of their discharge that they have this right to appeal. And I feel it's very important that people know what this right is. The proposal that I've written is not going to cause any tax increase. There is no fiscal impact to speak of other than whatever it costs to write a regulation. The hospitals, it would be very easy for them to comply. I'm merely requesting that they take a piece of paper, 8.5 by 11 would be sufficient, with large type, telling them just their basic right and giving them an 800 phone number and putting it someplace where the person is bound to see it. Next to the bathroom, for example, where theoretically they would have to be capable of going into their bathroom before they go home. They would see very clearly, without a lot of verbiage, that they have this right, so that if they or a family member sees this notice and says, oh, I didn't think Medicare would pay for it. Most people, if you ask them, will tell you, oh, I was told I had to go home because Medicare won't pay for it anymore. And they maybe are told this by the discharge person when they say, why am I going home tomorrow? Well, because Medicare won't pay for you to stay any longer. So even if they think they have a right to appeal, most of them think it's going to be on their dime. And of course, we all know it's a heck of a lot more than a dime. So that's why I brought this proposal up.
Senator Jaffe.
Yes, Senator Thompson. Unfortunately, 2 years ago, I had the experience of going through exactly what you're talking about. Number one, it is the responsibility of the discharge nurse to inform the patient of what their rights are. Secondly, Medicare has a contract with the organization, and I forget the name of it, that will intervene on behalf of the patient, that will stop the discharge at least for 2 days, and no costs are incurred.
Right.
And once the issue is resolved by the doctors of the hospital and the doctors of this, forget what the terminology is of the group, then the patient either goes home, either with somebody at home to take care of them. If there's nobody home to take care of them, then they are escorted or discharged to a care home or care facility for a period of time until their Medicare coverage expires. So I'm just curious, since the discharge nurse has the responsibility to do everything that you specified in your proposal, I'm just wondering what the proposal will accomplish.
Well, the proposal will accomplish giving the notice that the discharge planner is supposed to give and does not. unfortunately. I have an example for you of what really brought this home to me was I had friends that he was disabled and on a walker from a hip injury. She had back surgery. She had her surgery in a hospital approximately 100 miles away from our hometown. And she was told, you will go into a rehab facility until you're able to care for yourself at home, because she essentially didn't have anyone to care for her at home, her husband being disabled. On a weekend, the discharge planner came in and said, you are being discharged home. There are no beds in the rehab facility. Goodbye. Now, when I found out that this happened to her and she didn't know and hadn't been told about her discharge rights, I thought, okay, he's a retired attorney, she's a retired registered nurse. If they didn't know and have actual knowledge of their rights to appeal, and the board that does it, I think it's QID or something of that nature, it's a quality independent board that determines these. And again, it doesn't take them long to make a determination, but first you have to know you have that right. And it's unfortunate that discharge planners don't tell people. And I have not talked to anyone, and I've talked to many people that have been hospitalized or had a spouse or something hospitalized in the last year. Not one of them knew that they had this discharge right. Now, they knew because they'd been given a piece of paper, but they didn't have actual knowledge. They just had constructive knowledge, and that's not good enough when you're in that situation.
So what you're really saying is that the notice would be posted so it could be read,
right.
In comparison to what you say, that I think this is true, the notice is generally sent home with the patient, family, and disregarded.
Right.
And then comes the shock, they're going to send you home, and you're... So I agree with you. It's almost like putting the grade letter in the nursing home or in the restaurants. You know, is this an A, B, or C?
Let me just further add to Senator Thompson's testimony. As the Ombudsman Program Manager for 8 years, that was one of the most common contacts that we had from patients in the hospital. They were given the ombudsman number to call because they were usually going to a nursing home or something. And we would spell it out for them. We would give them the number because it's an 800 number. It's a very simple procedure. It's at least 3 days at no cost to the patient. And that is very reassuring. Frequently, it was the family member, the mother, the husband, you know, that had no knowledge of this patient's right. You're right, it has been in the code for a long time. And I'm not currently familiar with who's doing patients' rights right now, but because it has had several changes, so I don't know the specifics. But let me say that I think this is excellent because it would get it to the person, the patient, as they are improving. It would get the knowledge to them because you cannot depend on the overworked discharge nurse or social services planner or whoever it is in the hospital.
Dr. Steer?
Yeah, it's a very good proposal, Senator Thompson. One of the things that I'm interested in is patients' rights. A lot of times patients don't think they have rights. And I have a lot of senior friends, obviously, for my age. And I tell them when they're going into a hospital, you know, if you're not ready to go home, tell your doctor, I'm not ready to go home. I don't want to go home. And let that doctor then decide what to do. But especially rights. It all started with the insurance industry years ago. I'm a retired OBGYN doctor, and we had early discharge after delivery in 24 hours for some insurance companies. Right. And I told my patients, I said, no, you tell your insurance company you're not going home. You tell the doctor, well, the doctor, you're not going home, you're not ready to go home, and the baby's not ready to go home in 24 hours. Well, the same with seniors now with after cardiac surgery, they send them home on the second day, whatever. No, it's just not right. You have to express your desire and say, I'm not ready to go home, and I do not want to go home. And that's it. and then
Yes,
see what happens.
unfortunately, a lot of people definitely don't want to argue with their doctor, as you
Yeah, most
know.
people-
But most doctors I have found, if the patient doesn't feel they're ready to go home, they will work with them. But there are other doctors that say, I'm sorry, Medicare won't pay for it. And that is unfortunate.
Yes.
Madam Chair,
Oh.
may I make a comment?
We've already reached our 10-minute,
We are within a minute and a half.
so you got a minute.
I would say that to post something in the room, the discharge nurses have their instructions. They are legally bound to perform their information or discourse their information. If they would put a big sign in big letters, if you disagree with your discharge, call this phone number. Big.
That's what a
12, 14-point or pound letters. Forget about all the yes, that you got this right and that right and everything else. If you just have this big sign, if you disagree with your discharge, call this phone number.
Exactly. I wouldn't want a lot of verbiage. It should be, if it was you or I doing it, we would do something just like that. Now, obviously, if this would be put into legislation, then it would probably have to go through 14 committees and 27 hearings, and there would be people having to write pages and pages and pages of regulations, unfortunately. But hopefully the bottom line would be eventually we would have one form that said, if you're a Medicare patient, call this number if you disagree with your discharge. It should be very simple. I agree with you 100%.
Call the question.
All questions. We've
May-
called for the question
I'd
on,
like to have the maker of the motion add an amendment to that.
there, if you read lines 26, 27, 28, 29, 30, it says, provide a notice. I don't think we need to get into more verbiage on that regard, whether it's 10 inches or 2 feet wide. I think she's clearly spelled out what she's asking for. We did call for the question, so if you would call for the vote.
Yeah, Ehrman,
Yes.
Fromm,
Yes.
Jaffe,
Yes.
Casper,
Yes.
Miller,
Yes.
Pankhurst is absent, Steer, Woods,
That measure passes. 7 yes votes. It will be placed on the consent calendar.
Thank you very much. Thank you, Senator.
Thank you very much for listening.
Thank you. It looks as if we just have Joanna Kim Selby. Stroke education. Senator Joanna Kim Selby is here right on time. We love it. If you would please sit over here, Joanna. What?
Who is shouting at Joanna Kim Selby here?
We're ready to hear your proposal, SP 14, stroke education. Do I hear? All those in favor say aye. Aye. Senator Selby's bill is SP 14 on page 233 in regard to stroke education. Senator Selby.
Okay. Thank you for letting me testify for stroke education. And strokes are number one cause of adults long-term disability in the U.S. each year. About 795,000 people. Between 795,000 people, first attack will be 600,000 people, and recurrent is 195,000 people. And also, this is the third leading cause of death in the U.S. Over 143,579 dies each year in the U.S. And more than 16,000 people are killed in California each year. And then I'm going down the Contra Costa County data. 6 people suffer a stroke each day. 5 strokes are preventable. 2 dies every day in Contra Costa County. And 3/4 of 597,000 are over 65 years old. And the stroke can occur at any age. And in 2005, stroke was 6,500,000. And male will be 2,600,000. Female will be 3,900,000. So this case means more female when they get older get strokes. Every 40 seconds, someone has stroke, and $41 billion in annual health care costs and lost productivities. And the stroke stroke mortality in 2005 was 143,579. And in that figures, male was 56,586. And the female was 886,993. So 55,000 more women suffer strokes than men at older age. Younger age, men suffer more than female. And between 1995 2005, 10-year period, stroke death rate fell 29.7%. However, Afro-American death rates are higher.
Senator Selby, if I could interrupt you, we have read your proposals. We know what has happened in the background and so on. But if you would please just get to the point of your measure, tell us what it is you're asking to do. I think we all agree stroke is a major problem, health-wise across the ages, and we just want to know what you want us to do about this.
Well, I would like to give a stroke education to the public, and because some 74% of the people do not know the symptom of strokes, so they obviously do not know what warning signs are. So at least we have to give them warning sign, what's all about, and dizziness, blurring eyesight, and sudden confusion, and diabetes, and high blood pressure, and without exercise, lack of exercise, lack of healthy food, nutrition problem, then you're going to suffer the stroke. So we have to tell us what the symptoms are so people can understand that this one is a stroke education, nothing but the stroke education. That's what did. And last year there was a Assemblymember Davis made ACR 49 at last year for Afro-Americans, because Afro-Americans die and more than white people. And the year before that, SCR 85. Senator Elaine Alquist had a SCR 85, because I feel that we really have to educate the population, young and old, all of them, in order to reduce our fatalities and also the expenses. The cost is very high, because after stroke, long-term care is the real issue. That's the disability. And that's why I want to have stroke education.
Senator Selby, I think if we were looking at on page 236, where you're trying to specify what you want the state of California to do about this, you say, for instance, on line 89 and 90, the stroke education campaign shall consist of seminar programs in various facilities, including but not limited to, da, 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 da. The word shall makes that's what they have to do. I believe, Ledge Council, doesn't the word shall indicate they would have, just let me see what.
Well, if you feel that has to be amended,
let's see what
then
Ledge
go ahead and
Council.
amend it.
Let her talk, let Ledge Council talk.
Right.
I'm sorry, we're on 236. Do you see the word shall?
Shall on line 90, the bottom line, the first word shall.
Yes, then that would.
95, there's shall.
Yeah, on line 95, there's another shall.
Well, as to the shall on page 90, it says the stroke education campaign shall consist of. So those would be things that would be required to be in the education campaign. However, it is including but not limited to, so things beyond what is listed could be included.
But the word shall indicates that it must have.
Anything that's explicitly listed there must be there.
Okay.
Same with the second shall.
Yes. Excuse
Yes.
me, Dr. Steer.
Yeah, Senator Kim Kelby.
Yes.
I know that a political campaign ends after election, and a military campaign ends when the battle is over. But what about a stroke education campaign? When does it end, and when is it ongoing, or that's what
I guess if you don't like a campaign, then we can get rid of the campaign and the stroke education.
Because education has to be ongoing all the time,
Right? It's
as do people come into that certain age group.
because even Contra Costa County, we do have education going on. Because as advisory council member, there were 5 physicians in there, and those 5 physicians go out of the community. They disseminated the information, what's the strokes all about, and that's why I put education. But if you think a campaign sounds like a military action, then I'm willing to take your amendment.
So it would be ongoing. It won't be just
ongoing. It must be ongoing because. Contra Costa County started this and 3 years ago, still ongoing, between the TV station of a county and also taking to the supervisor's office or senior centers, any congregated area, they go out and disseminate the information. So, and also what we do is IHS providers, they have to know the stroke symptoms because they were dealing with this stuff.
Senator Selby.
So that's why.
Senator Selby, excuse me. I think, again, we're talking around this so long. You could say that it could consist of programs, but what about
line are you talking
what about just suggesting that senior centers do have a stroke campaign? What about something like that? Because if you're going to make this a law that they have to do this, I don't think it's going to fly.
I thought Senator Stir already asked me about the campaign, word of campaign. It's not the military campaign.
We were questioning the word.
I said I would accept that amendment, eliminate that campaign. It's already.
Okay. Senator Woods.
Point of information, Senator, you mentioned 2 other bills that in the past, did either of those 2 bills become law that you mentioned?
2 bills, SCR 85,
right.
Is Elaine Alquist, Senator Elaine Alquist. ACR 49 is Assembly Member Davis, because ACR 49 is specifically addressed to Afro-Americans.
Yeah, but what I'm asking you, was either of those 2 bills chaptered?
Yes, they were chaptered.
And they were chaptered.
Yes, resolution, as you can see, I didn't say bill. I said SCR, ACR. So they are the resolutions, and they were chaptered.
They were chaptered. Thank you.
Time is up.
May I say? Senator Selby, I am opposed to your bill. Not that I'm opposed to the education, but I'm opposed to the concept. You stated a bunch of figures that are irrelevant right now. I don't know what a state law would do to compel education. You have people that go to cardiologists. You have people that go to primary doctors. They watch their blood pressure. They watch their diabetes. They watch many other organic functions of the body. Symptoms of a stroke are insidious. And I suffered a stroke in 1993. And I know different symptoms of a stroke. It can be anywhere from a sore throat to a sore toe. So when you go into educating the people, you can't educate them to every possible thing. And I think that a state law compelling senators, senior centers to give an educational course, chances are that some of the information would be erroneous. Some of it wouldn't include all the necessary information that they should get. And I would leave the education up to the medical profession and not mandate a state law to have this education, because there are many centers that on their social programs, they will engage a doctor about talking about strokes and a heart attack and things like that. So I think this law would be superfluous.
Thank you. Thank you. Does anyone else want to comment?
Also, maybe to narrow it down more to just seniors, because on page 234 you mentioned adults 20 years of age and over, maybe just eliminating some of the facts that aren't really senior facts and make it more precise and not so, more precise just to seniors, I think would help also.
Can you call the question, please?
Would you please call the roll?
Ehrman?
No.
Fromm? No. Jaffe?
No.
Casper?
No.
Miller?
No.
Pankhurst is absent. Steer? Woods?
No.
The measure fails on 7 no votes.
Thank you for presenting your measure
Well,
to
thank
us.
you very much for
Senator
hearing.
Selby. Look at that, 2:45.
What do you do with your pink copy?
We have finished.
Okay.
Excuse me, Doctor. We have finished the business for today early. And what I would ask you to do is make sure you do go over the Assembly health bills so you're ready for tomorrow to hear them. And I think we did a good job today and we got it all done. And is there anything you would like to say, Madam Resource Person?
I should be more on time tomorrow. Thank you for your patience with me today.
I've already got some red marks for you.
Well, I don't need to listen to those.
Okay, I'll try. Now, Ledge Council, thank you very much. And she was here before I was here. I was probably the last one here. But anyway, thank you very much, everyone. Thank you, Will, for answering the phone. Thank you, Barbara, for running. And the meeting is adjourned.